Hello, I'm Dr. Nafis Ahmed, Chair and Medical Director of the Stone Springs Emergency Department. Today, we're going to talk about strokes. So, what is a stroke? The brain needs blood for it to function. When the blood vessels or arteries that supply blood to the brain get blocked or burst, we call it a stroke. There are two kinds of stroke, an ischemic stroke and a hemorrhagic stroke. An ischemic stroke is the most common type of stroke. That occurs when the blood flow to the brain is blocked, either by a clot or plaque. The brain needs blood and the oxygen and nutrients it supplies for it to function. Without this, the brain cannot function. A hemorrhagic stroke occurs when the blood vessel bursts and there is bleeding into the brain or around the brain. Next, we'll talk about the signs and symptoms of a stroke and how to quickly identify them. A great acronym to use is BFAST. B stands for balance. Does the person have a sudden loss of balance? Are they veering to one side when they walk? E stands for eyes. Is the person losing vision in one or both of their eyes? F is for face. Does the person's face look uneven? Does one side seem to droop more than the other? A stands for arm. Is one arm hanging down? Are they unable to hold both of their arms up? S stands for speech. Is the person's speech slurred? Are they having trouble finding words, or do they seem confused when they talk? And finally, T stands for time. Time to call 911. It's incredibly important to call 911 anytime you recognize any signs of stroke. When 911 is dispatched, they tell us at the hospital to be prepared when your loved one arrives. We are certified by the Joint Commission as an advanced primary stroke center, which means you or a loved one can come here in your time of need if you're experiencing any signs or symptoms of a stroke.